welcome to the HITea With Grace podcast, where we spill the tea on HIT. Today, I'm honored to introduce you to Dr. Sherri Onyiego, Senior Medical Director at Equality Health. Thanks for joining us.
Thanks for inviting me. Appreciate the opportunity to be with you.
Absolutely. So tell me a little bit about the career path that led you to your role today.
Well, I guess I can start at the beginning. I mean, I'm originally from a small town in Louisiana, and so it's not like I had any physicians in my family, but I was definitely, I certainly had a gravitation towards healthcare. I remember even as a kid being a candy striper and volunteering in the hospitals. And so definitely always had a passion for wanting to do something in the space. And so obviously stayed with that as a young child, wanting to continue to fulfill that dream. And so I think as I sort of made a decision during college and got into grad school and then med school thereafter, I really was pulled to the whole aspect of full scope primary care. I just love the ability of having relationships with people. And I think that probably stemmed from my childhood because I was nurtured by my full community. And I think in a lot of ways, family medicines their work is so communal because they're taking care of people from cradle to grave. And it's all about nurturing those relationships. And I really, really love that aspect of healthcare. And so that was sort of the specialty that stuck out for me. And then I kind of had an interesting path as well. And I kind of went into really wanting to make sure that patients who had a lot of these chronic diseases like hypertension and diabetes that we also see in primary care, that their HIV was also managed. And so I ended up doing a fellowship in HIV medicine. So I combined both my chronic care management panel of primary care with a patient panel of folks living with HIV. And I took care of those patients for a number of years. Yeah. And so then I did that work in a community-based setting here in Houston that was combined with an academic medical center. And so I was able to really engage with medical students and residents over the years as well, while I was managing those patient populations. And then I decided to kind of take a step back, and I wanted to kind of see, well, what are some of the things that I can kind of do to lend my voice to more of a primary prevention aspect and zoom out, like lending my voice from that perspective to help on the sort of broader scope, policy, advocacy. And so there was an opportunity that came available with our county health department here in Houston. And so I ended up working in that space for a number of years, really focused on bringing chronic disease programs to communities all across Houston. And so that really sort of introduced my sort of love for population health from that perspective. I mean, Houston is one of the cities within Harris County, but if you zoom out, Harris County in and of itself is probably larger than Rhode Island. So we have probably upwards of over close to 4 million people in our county. And so if you think about the center of the county where Houston is, that's the largest medical center. But still, when you think about people outside of that epicenter, they don't have access to care. And so that really sort of broadened my scope to really understand the implications that so many people throughout the communities are impacted by. I mean, because health happens outside of the traditional four walls of the clinic. And so in really sort of diving into that space, you kind of look at what role does our faith, what role does where we work and where we play, what are all of these things that sort of impact how people, community, families engage and can live their healthiest time. I mean, that work probably sparked so many programs and projects looking at how people in one zip code live longer than people in other zip codes that are probably within miles of one another. So I did that work for a number of years and then transitioned to my current role in Equality Health, which really, in my opinion, kind of marries both, right? With a population health lens of really working with primary care practices across multiple state markets, and then also working very closely with a number of managed care organizations to ensure that we're able to open up access to care for individuals with Medicaid in a value-based framework. And so that's sort of
That is so inspiring. And we are just so honored to learn from you today. So thanks for taking the time out of your day to be so generous with your insights with us. So a lot of people in the industry are saying the value-based care trend or term may have lost its meaning. What does that mean to you given your experience and where you see the industry is at now?
Yeah, you're absolutely right. I think that it has become somewhat of a buzzword in some regards. And then I do see that school of thought where it's just sort of been dropped altogether in some conversations in some spaces. But the way I think about it is it really is one of those situations, one of those values that is at our core at Equality Health, because it really is at the end of the day a shift towards how healthcare is really sort of being socialized across multiple different spaces. And so I think it's one of those situations where we have to kind of think about sort of how healthcare has traditionally been viewed as more of a transactional sort of relationship or service delivery sort of dynamic to more of a quality focus, right? So what are those things where we can sort of change the frame of mind from a reactive visit where I just go for one issue that happened to me maybe this week with an ankle sprain, but I'm also living with hypertension and diabetes, and I'm not necessarily sort of having a strong relationship with a primary care provider or with my PCP. So it's more of a move from that reaction transactional based health delivery to really more of one that's quality and focused, proactive, right? We're proactively trying to make sure that we're reaching out to individuals, families, to really help ensure that they're having a healthier experience, right? That we're managing those chronic conditions, that we're getting those preventative care opportunities addressed before they can potentially go into more higher cost situation.
That makes so much sense. And especially hearing even your background, even a little bit, you see why, right? The zip codes having different care, the access being a challenge, et cetera. So I'm interested in learning, as you are the Senior Medical Director at Equality Health. Can you tell me just specifically what the Equality Health care model is and how are you trying to improve things in this space?
Yeah, I mean, first off, Equality Health, we're a Medicaid-first organization. Some people would call us an enabler, if you will. So we essentially focus on helping primary care providers across the spectrum. And so those could be primary care providers who are independent practices that still have up their shingles. It could be health systems, federally qualified health centers. So it's a diverse network of primary care providers that we enable, that we in essence help them to be successful in value-based contracting. Some of these providers that we work with they may have some experience working directly with the managed care organizations to do that type of work. Some may not be experienced at all. And so, because what I'll tell you is that it takes an investment to really be successful in value-based contracting. You have to have certain systems in place to be able to know who your full panel of patients are who are living with diabetes, hypertension, and you have to have the insight to be able to tell you what quality care gaps are open for that patient. What do they need to be addressed that will also find itself in compliance with that contract that's holding you responsible for those measures. And so oftentimes that takes a significant amount of investments, resources. And so some practices may not necessarily have that financial wherewithal to do that. And so in essence, we enable a number of these practices with resources to be able to help them understand their patient population. And so if you think about it from that perspective, we're kind of like a triangle. You have us that's helping the primary care provider. We're partnering also with the health plan upstream on those high-risk contracts. But then also we have the patient, who's also a critical part of the structure, because although our practices are responsible from a healthcare delivery perspective with the patients that they have on their panel, oftentimes practices may not have all of the other components that help that patient outside of the clinic, right? A number of these practices may not have a care navigator or a social worker who can help uncover community-based resources that patient may also need. That patient may also need housing assistance. That patient may also need food assistance. If you think about your diabetics who need to keep their insulin refrigerated, and think about all of the things that go along with that socioeconomic dynamic that patient and family is dealing with, not every practice has an embedded resource to take care of all of those types of needs. And so a big part of our model does help practices, almost like extensions of the practices, to really help with care navigation, addressing some of these non-medical drivers that I just referenced.
You're like a practice sweetener. Plus, right? It's fantastic.
Yeah.
So can you tell me more about the importance of the community health worker today in value-based care?
Yeah, the community health worker and is so critically important. And we found that community health workers not only have a unique and important way of connecting with the community, because they are typically, and in some regards, a fabric of the community. They know the community. They sort of can uncover a lot of things about the community that, for lack of a better word, people who may be in more organized or zoomed out sort of seat, if you will, don't necessarily have, right, from a boots on the ground perspective. And so they are so critical because they're really able to lean in not only at the individual member patient level, they also have those tentacles and roots into where's the housing pantry, the food pantry or the housing organization that's still open, that's still taking cases, that's still making those community sort of linkages fruitful, rewarding, and meaningful. So they typically are really key enablers to making sure that patients' families get the important resources that they need. When you think about it, like I was mentioning, I think that they are really critical to reaching out to patients during important touch points with the healthcare system. We've continued to see really important strides that they've made with engaging with folks who are already in the hospital and making those connections. While an individual is in the hospital, they're more likely to be able to have develop a relationship, develop a rapport. And then as that individual who's in that sort of critical time period in their life in a hospitalization, and they meet their community health worker, that community health worker can then continue to usher them after the hospitalization into the important follow-ups that they need after that. It's really been so rewarding to see the work that they're able to do. Just, like I said, true boots on the ground that's really making an impact and really moving the needle. I think that I know a big component of our model being so successful is with the work that our community health workers are doing by really uncovering so many of these social drivers and non-medical drivers that are impacting individuals and families.
And it really is just a more holistic approach.
Absolutely.
When you can understand what's actually happening in the community or plan or in every element of the framework. It's fantastic.
Absolutely.
So in value-based care, I'm wondering, why is it important to focus on primary care and specifically independent PCPs? Like, why is that critical to what you're doing?
Yeah, kind of like what I was saying before. I mean, I'm at the heart of who I am as an individual, and this is why the work resonates so much to me, is because primary care is sort of at the heart of it, sort of as a quarterback. They really sort of, they know they're calling all of the balls and strikes, right? They sort of see the plays down the field. They know that Miss Jones, who has diabetes, also needs to make sure that not only is she taking her medicines, she also needs to make sure that she's getting that important eye exam done. The ophthalmologist may not know about her also being on an expensive medicine that we need to make sure that she's continuing to take. So I think the primary care provider is uniquely positioned to see where all of the dots are and to make those important connections with their individual.
Yeah, that makes tons of sense. And I'm wondering too, why is it important to focus on Medicaid? You mentioned being a Medicaid enabler. So what is that? What's that about? And why is that critical?
Yeah, I mean, we think that obviously the Medicaid population is a unique population. We know that they have a number of historical challenges. It's a population that's diverse. Historically, in certain communities, they may be underserved, challenged with having a number of things, right? Fragmented healthcare, higher utilization of maybe more expensive healthcare settings. So maybe with higher ED utilization. And so it's that population that we have been uniquely committed to from day one. We know that we have to have a healthcare workforce that's positioned to be able to respond to them, that's positioned to be able to meet them where they are, right? Meet them where they are from a cultural perspective, meet them where they are from a healthcare delivery perspective. And that's why it's so important that we're enabling and providing these practices in our health systems with the resources, because they are really doing a lot of the onus of taking care of these populations that historically may not engage in the same way with the healthcare system that others.
And I'm wondering too, what trends are interesting in the space? What regulations are you focused on that you kind of keep track of as you are moving this effort forward at Equality Health?
Yeah, I mean, I think that from our perspective, we're continuing to look at ways that we can best utilize the data, the insights. Data is always a way that helps us to be able to make sure that we're equipping our practices and our providers with the insights that they need to better take care of their population. I think it also helps to ensure that as patients are sort of navigating and moving through different elements of the healthcare ecosystem, that we have a sort of a robust communication and know where those touch points are, right? I think that's a huge part of it. And so I think the trends for us is always trying to ensure that we have an eye on what's happening with ways that we can streamline data, improve the data, ensure that it's enhanced and it's robust. Obviously, I think it goes without saying too, AI is a big focus amongst healthcare right now, and really trying to figure out ways to best position and see what's out there in that landscape is always
Oh, it's so interesting. And what areas of AI are you seeing having an impact here in your kind of Medicaid value-based care enablement world?
Yeah. I mean, I think that as we engage directly with patients, I think AI in that framework of better ways to engage with more patients as opposed to maybe smaller amounts. And I think that AI enablement can help us maybe reach larger masses and larger quantities of and then streamline efficiencies. I think a lot of it is going to be ways to just enhance and make our work more efficient from a process perspective. Certainly not in an aspect of replacement, but certainly an enhancement. I can just personally, I went to see my daughter, took my kids for a primary care visit with their pediatrician not so long ago, and she was ranting and raving about a new AI enhancement that she was utilizing to help her. And so I think that anything that we can do from our perspective as a value-based enabler, we're always looking for things like that because we want to make the individual's provider's workflow streamlined and more efficient as well. So, but I think that's how we're looking at it from that perspective.
Do you feel like value-based care enablement is almost synonymous with health equity enablement? And like, what does that mean to you? Like, how are you seeing health equity inequities being really supported in terms of changing those things around?
Yeah, I mean, I think so in some ways. I mean, I think health inequities is really, we want to make sure that everyone has the ability to live to their highest potential. To me, that's what it's all about. And so I think in and of itself, at the core of us really reaching into this population, the Medicaid population, we're trying to level the playing field by making sure that they have access, right? And so, yes, I think that there are some synonymous or parallel overlays with the work. It's a huge part of it. And I think that historically, when you talk about inequities, you can't forget about the health disparities, right? There's so many disparate populations within the Medicaid community or those recipients on Medicaid. Think about things like chronic disease burden. Think about people who are in rural communities versus urban communities. You think about maternal health disparities in the Medicaid population. We see about 50% who are Medicaid recipients that account for our deliveries. And there's so many health disparities amongst the population, just in the maternal health space. So yeah, I think that to me, I can never talk about health equity or inequities without forgetting that there have been so many historical health disparities along the way that we're still trying to grapple with.
Oh, absolutely. Absolutely. Amen, sister. You're right on track. And I couldn't agree with you more. As we're kind of thinking forward, I'm wondering if you could say anything to the primary care physicians that are listening to this, like what message do you want them to be aware of as we're kind of moving into our section here?
Yeah. So no, I would say thank you to them. And I think that the work that, as I mentioned earlier, the work that primary care does is integral to not only managing patients and families and communities from cradle to grave, but they're also so critical and key to prevention, disease management. So much of that is really where value-based care has an important component in. And to me, primary care is just right to be able to be true participants in it. And I know that from a CMS perspective, I think we've all sort of heard the charge of really ensuring that a lot of these value-based contracts that are wrapped into Medicare and Medicaid, that's where things are going. So whether or not primary care practices are sort of primed to do that work independently on their own, or if they want to join forces with an aggregator and enabler like Quality Health, I think those are the decisions that sort of one has to make in terms of what works best for them. But I would say that this is sort of where things are going, and we're here. I think that this is where we are. And so I think certainly I always have an important part of my day-to-day is talking to primary care providers across the spectrum and hearing from them and hearing the work that they're doing and really them understanding how we can sort of partner and really sort of arm them with additional resources to help better take care of their population. I think it's always been something that's been really appreciated and continues to be. It really gives me great pleasure with the teams that I am charged to work with as we're working with practices to help ensure that efficiencies and interventions are rolled out to help them sort of really address the population and really help to move the needle. I think that's always been the gratification that I get from.
I love that. You hear that, everybody? Thank you. And don't give up. There's hope. There's help. Like you don't have to do this alone.
You don't have to do it alone. Don't have to do it alone.
Fantastic. So as we move in, I know our listeners love to learn about what's going on in the industry, but they also love to learn about you as a leader. So can you tell me, in your busy work life, what are things that you do to work your best and make a difference?
Yeah, I think I always like to learn. I mean, I think from my perspective, I'm always a lifelong learner. I've worked best on multifaceted and very sort of multidisciplinary teams. And so from my perspective, I love learning from others. And so whether that's in integral teams, whether that's on a committee that I'm on, whether that's in my community, I love it. And so I think whether that's going to conferences, reading, those are the things that help me to kind of stay connected.
Absolutely. And as obstacles have come your way, what are some strategies you've put in place to be able to not be just totally destroyed by them?
Yeah. Well, I would say I try not to get too bogged down into it and let it be too all-consuming. For me, sometimes what I'll do is try to sort of zoom out. Part of it for me is ensuring that the physical health is there. I think a lot of sort of how I process things that may sort of continue to fester and sort of manifest themselves as stress. I try to stave it off as best as possible. And so physical activity has been a huge part of that, even if it's just a walk. And so just pouring into that and trying to tap back into that has really been helpful. I even tell that to my patients. I still have a small panel of patients that I manage. And so that's a huge part of it for me, because it definitely can consume people, right? As things come at you in multiple different directions, it's really about how you're processing that and taking care of yourself in the midst of it.
Absolutely. And if you could give your younger self a piece of advice, what would that advice be? Don't
be afraid. Just take chances. I think my younger self, I think I'm glad things happened the way they happened, but I think for a lot of times I was fearful to do certain things and take certain risks. So I think I would do that, because again, it's sort of like what I tell my kids: if you'll never fail at the things that you don't take that chance at, right? Those will be the things that you regret, because you regret a decision that you actually never really took the first step to try it. So
absolutely. Don't be afraid, everyone, right?
Mm-hmm.
We're here to support you and empower you.
Yeah,
you got this. So to finish this conversation off right, where can our listeners find you online?
So I'm on LinkedIn on my line, and then I have a lot of connection and I have a lot of connections, or I try to put a lot of the content that we are doing in the community with Equality Health. So LinkedIn is a big place. EqualityHealth.com also is a good source to just learn about our organization, as well as our LinkedIn page. But I'm all pretty active on LinkedIn from that perspective as well.
That's terrific. Now, before I forget, did you happen to bring tea with you today?
I did. I brought tea.
Awesome. Tell us about your mug.
Yeah. And it says Grace Upon Grace. And I guess that my daughter's name is Grace too. She's 13. And so a big part of our sort of family mantra, our family creed is faith, and just reflecting on God's grace and his goodness. And so yeah, that's a big part of the mug that I brought today.
That is fantastic. And we were talking about earlier that is the scripture verse that my parents named me after. Yeah. Grace Upon Grace. They actually named me Grace, and then Ann, my middle name, means grace. Beautiful. So they named me Grace. Yeah. So it couldn't be more fitting. And that's a wonderful story. So thank you so much for joining us. It was awesome learning from you today.
Yeah, thank you so much, Grace. I really appreciate it.
And thanks to you folks for joining us too. Check out the HITea With Grace podcast for more interviews with esteemed guests like Dr. Sherri Onyiego today. Cheers! Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.